A warning. There are various diseases in Indonesia that you don't really encounter here in the US. Surprisingly, malaria is not a big deal over there. In fact, I was not required to get malaria immunization to go over there. You'll get most of the immunizations you need, but there's one disease you want to watch out for, and it's called dengue fever. The Indonesian word for it is bone break, or it's also called bone break fever, or in Indonesia it's demam berdarah, which means the bloody fever. And what it does, the reason it is so dangerous is it lowers the blood platelet count the platelet count in your blood, which is how you stop bleeding. A normal person has 300,000 to 400,000 parts per million for platelet count. At 100,000, you need to be on bed rest just because your body's trying to fight it and you don't have the energy. At 50,000, I don't know if this is in every case, but in my case, at least, my digestive system started shutting down to where I didn't eat for 4 or 5 days because I couldn't. But at 50,000, you need to be hospitalized because you can't hydrate yourself well enough. So you have to go on an IV. At 20,000 parts per million, you need blood transfusions because your blood can't hold out. And at 5,000, you have died from internal bleeding. The first time I got dengue fever, I got down to 28,000 parts per million. The second time I got down to 14,000. So I set the mission record for worst case ever and then said, meh, I could beat that. First time I got it, I mean, head to toe, it looked like I had a terrible sunburn, like I'd laid out naked in the sun. But what it was is that all the capillaries beneath my skin had burst. And even going through like the week of recovery where the fever was over, that still itched like crazy. But it's not really treatable. There is no vaccine, there is no medicine to fight dengue fever. The treatment plan is kind of like a cross your fingers and hope you live situation. You do need to be hospitalized just so they can help hydrate you and they can administer blood transfusions if necessary. And it kind of operates, from what I've heard. My second mission president was a doctor and he was well versed in dengue fever, so I talked more about it with him. But it kind of follows baseball rules. 3 strikes and you're out. There's 4 strains of dengue fever. Very few people survive getting a 3rd strain, and I have 2 of them now. From what I was told, there's only 2 of the 4 strains that exist in Indonesia. So, you know, I could probably go back there safely, but it'd still be kind of dangerous. But the important thing is that it is preventable. There's only one species of mosquito that carries dengue fever. It's the Aegyptus mosquito, and it's only active during the early morning and kind of like late afternoon heading into evening. But you want to wear bug spray anytime you're going to be in a place where you're going to encounter mosquitoes. Yeah, basically wear as much bug spray as you can and they won't bite you and you won't have to deal with dengue. And trust me, you do not want to deal with dengue.